Thank Senators Murray and Baldwin for being here just 4 days away from open enrollment. Now, where are the Republicans? House Republicans are on week 5 of their vacation. Trump's not even in the United States. And Senate Republicans are running exactly the same failed play that brought America to its knees. Americans are on the brink of a health care crisis, unlike any we have seen in our lifetimes. In states like New Jersey, health care costs are projected to soar by 175%. In New York, the average family, with a plan costing $280 a month, will pay $1,700 a month for the same plan next year. This isn't just a number on a page. Families are going to be in panic this weekend. All across America, millions of them. How are they going to pay this bill? How are they going to live without health care? It's tragic. And of course it didn't have to be, but Republicans are doing nothing. 1 ounce of urgency to fix the health care disaster they created, they're doing nothing about that. So, we're on the precipice of a historic crisis, and Republicans don't even want to talk to us about fixing it. And Trump, where's he? Not even in the U.S. What's he focused on? Trump's focused on $40 billion for Argentina, $170 million in luxury jets for Kristi Noem, $300 million for his ballroom. In fact, his ballroom says that is his main priority. Can you believe that? You can't make this stuff up. His #1 priority is his ballroom when people are suffering? What kind of president is this? Pay for his ballroom and not a dime to stop the health care crisis. Millions of hungry children, families, and veterans are about to lose SNAP benefits, food on the table, because Trump personally ordered the Department of Agriculture to rip up its own contingency plan. It's a plan that Republicans like Don Bacon and Susan Collins endorsed. The money is there. The hungry people, the hungry children, the hungry veterans, the hungry elderly could be fed. But Trump's using them as hostages. How cruel, how vicious, how out of touch with people is this huge ego of Donald Trump. Trump deleted the USDA plan from its website. You can see it. Gone, vanished, and erased. Republicans now say the USDA can't use SWAP's emergency fund, but USDA's own shutdown plan said they could and would use it. So this is just pure, vicious hostage-taking. Under past shutdowns, both Democratic and Republican administrations, SNAP was used. SNAP was never lapsed. Not once in modern history, but this is a precedent-breaking, deviation down presidency, deviating further down than we have ever seen. And the administration knows how to do it itself. In 2019, Trump funded SNAP through a shutdown. He's just choosing not to do it, choosing to have kids go hungry. Terrible, awful. The same administration that found $40 billion for Argentina and trillions in tax breaks for billionaires tells hungry kids you're on your own. Senate Republicans silenced, paralyzed, too scared, too cynical to stand up to Trump, even under this situation. Where are the Republicans? As people are losing their health care and have huge pain and pits in their stomach about what to do about it, where kids are not getting fed, Trump's out of the country, House Republicans are out on vacation, Senate Republicans are out to lunch. And every day the shutdown drags on, the pain is deeper. So it's time for Republicans to get serious about ending the shutdown. So today, Democrats will introduce a bill that would extend the SNAP funding and WIC to make sure no child goes hungry, no family goes without food, no lapse will happen. And we'll get broad, if not universal, support in our caucus, and we will try to get it passed on the floor. We will try to get it passed on the floor. Bottom line, it's time for Republicans to start getting serious about ending this shutdown before families lose their health care, their food, and their faith that the President, that leaders will deliver for them. Patty.
Well, right now families are window shopping for their health insurance coverage next year and seeing that their premiums are set to double, triple, and in some cases even quadruple. Why? Because Republicans are refusing to so much as negotiate about saving the ACA tax credits. And on Saturday, a few days from now, things are going to get very real for families because open enrollment will begin. Republicans keep saying later, 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 but there is no later. This is happening right now. Republicans keep saying we'll talk about maybe, possibly doing something after the shutdown ends, but they were totally unwilling to say or do a thing this entire year when the government was open. It is painfully clear that Republicans are not listening to folks back at home, because what families nationwide are saying is, please stop my premiums from doubling. And what Republican leaders are saying? Not our problem. We never wanted to lower health care costs in the first place. You know, people back home are saying, please help, I'm going to be priced out of my health insurance. And some Republicans here are saying essentially, if only Democrats never protected those pre-existing conditions and never expanded Medicaid, we'd all be better off. You see, Democrats think it is a problem that people are going to lose their health coverage. And meanwhile, some Republicans seem to think it's a problem that people got covered in the first place. Genuinely, some of my colleagues across the aisle cannot open their mouth without saying repeal Obamacare. Maybe that's why Republican leaders are more serious about avoiding the health care debate than they have ever been about funding the government. House Republicans have been on vacation for 6 weeks in a row. They are scared to negotiate and scared to stand up to Trump, who's even joking he's Speaker of the House now. As for Trump's shutdown approach, he is gleefully firing people en masse. He is gloating over cutting, quote, Democrat priorities, shoveling $40 billion at Argentina, while refusing to tap emergency funding for SNAP benefits and letting kids go hungry. Not to mention he is obliterating the East Wing of the White House for his gold-plated ballroom. He is raising taxes on America out of spite. He's asking taxpayers to pay him $250 million, and all the while posting nonstop AI slop, anti-vax nonsense, and a lot more. It is very obvious that Trump does not care about ending the shutdown or stopping massive premium hikes. I mean, if Republicans passed their partisan CR, President Trump is not even in the country today to sign it. Does that sound like a president who is interested in ending this shutdown? Does that sound like a president who actually cares if millions of families lose that health care coverage? It is long past time for Republican leaders to get serious. Get serious. I could not be more frustrated that they refuse to fix this so we can reopen the government and save our families from Republicans' health care crisis.
Thank you. Thank you so much. And healthcare is personal. It's certainly personal for me. For those of you who don't know, I entered public service to work on healthcare policy. It was based on my own healthcare experience and my family's experiences. When I was 9 years old, I had a very serious illness, similar to spinal meningitis. It wasn't the exact diagnosis, but it put me in the hospital for 3 months. And after I fully recovered, my family couldn't find me health insurance at any price because I was labeled with those words, pre-existing health condition. And back then, insurance companies could simply refuse to insure somebody who was sick or had been sick. The Affordable Care Act, when we passed it, ended that type of discrimination. And of course, then we built upon its affordability in later years with the affordable premium tax credits. That brings us to today. In just 5 days, open enrollment begins for people who purchase their health insurance through the Affordable Care Act marketplace. Nearly 25 million Americans will see exactly how much more their health care will cost next year. Yesterday in Wisconsin, my constituents got a sneak peek. For an average family of 4, their premiums are skyrocketing by nearly $17,000. For an average 60-year-old couple, they will be paying more than $24,000 for health care next year. We found some folks, a 60-year-old couple in northwest Wisconsin making $85,000 a year, that will have to pay $33,000 more for their premiums next year. Yes, that's $33,000. And every one of these numbers has a face behind it, a story behind it. They all have to put their budgets together, figure out how the paycheck is going to last for the full month. Where are they supposed to get this type of money? Rent and food are a must. Do they sell the car? Do they take it out of their retirement account? What we know is that 4 million Americans will look at the price hike and say, it's too much, and I will go without health care. This is 100% avoidable, but my Republican colleagues are simply refusing to act. They've blocked us from giving families relief 10 separate times, but it is not too late to act. Come to the table and address the healthcare crisis and reopen the government. And President Trump, come back to the United States and address the crisis American families are staring down right now. And I'll end on this. I was recently asked about the political ramifications of this fight. Something along the lines of, will this help Democrats in 2026 on the ballot? I just want to say, to me, this is not about politics. This is personal for me. It is personal for the millions of Wisconsinites I represent here in the Senate and the millions of Americans who are staring down this health care cliff.
Thank you, Tammy. We'll take some questions. Back there, back there.
Today we saw in Hyattsville, Maryland, several federal workers lining up to get free meals. We've seen the AFGE statement, as you're well aware. What kind of pressure, if any, do you see those type of things having on your company?
Look, I think it's very clear. We Democrats want to do and have always said we can do both. We can provide all the help, provide pay and furlough and back pay for federal workers, and fix the health care crisis. And all they have to do is sit down and negotiate with us, and both can happen. Yes, yes.
Did AFGE President Everett Kelly speak to you before he put out a statement Monday, and how do you respond to his statement that both parties have made their points, now it's time to reopen the government with a clean, continuing resolution?
Very simple, same thing. I told him we can do both, and we need to do both. Both have federal workers get paid in every way and negotiate a way to resolve the Americans' pain in the health care crisis. Yes, yes, yes.
Putting blame aside here, what is your strategy to end the shutdown?
Look, on November 1st, people in more than 30 states are going to be aghast when they see their bills, and they're going to cry out. And I believe there will be increased pressure on Republicans to negotiate with us.
Are you going to vote for Mamdani?
The classics never get old.